Hi, everyone, and welcome to the 48th episode of Battles and Voices. I'm Lathika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Battles and Voices brings together generations of people involved in healthcare in order to foster a supportive and connected community.
Please welcome our guest, Dr. Sidhu.
Dr. Sidhu, thank you so much for being a part of this episode. It truly means a lot to us to have you on Battles and Voices today. To start us off, feel free to kind of introduce yourself and share a little bit about what you do.
Okay. I'm Dr. Anu Sidhu. I am a family practice and a lifestyle medicine doctor. I'm also the proud founder of a direct care practice here in Houston called Spring Monarch Primary Care. I also am an assistant clinical professor and teach medical students. I have three kids, and I love medicine, and I'm so happy to be here.
Tell us a little bit about what inspired you to go into healthcare and a little bit more into detail about what you're currently doing.
I actually, growing up, was not like the kind of person that just had to be a doctor. I really thought I was going to be a teacher and then a lawyer. And I think when we're younger, like just anything that we show any interest in, it, everyone kind of pigeonholes you into doing that. And then just at some point, I just decided that I wanted to go into medicine, and it was a huge pivot and unexpected for anyone that knew me. But it was definitely the right choice, and I'm glad I listened to myself. But it just kind of came about suddenly, and I'm just kind of glad I followed that instinct. Today, I own a direct care practice here in Houston. I see patients full time, and I also educate people on social media about their health and trying to empower patients to sort of be their own CEO of their own health and take charge of their health. And they can only do that by understanding what's going on. So I stay pretty busy with all of these ventures, but I wouldn't have it any other way.
I really love that. So, you mentioned you originally went into medical school with an interest in psychiatry. What drew you to that field, and how did you eventually find your way into family medicine?
So, yeah, I went to med school because I was sure I was going to be a psychiatrist. Because the whole reason I went to med school was because I was fascinated with how the brain works, and just not necessarily the neurons and the technical portion, but just how we think differently and how where we come from changes how we think, just how our brain works to make these connections to individualize us, and how that changes, mental health issues versus good coping skills. All this stuff just absolutely fascinated me. So I went to med school so I could be a psychiatrist. And then while I was in med school, I realized that that probably wasn't something I could do all day, because I am an empath, like through and through, I'm an empath. And I realized that if all I did all day long was psychiatry, I would probably get burned out. And I wanted to do medicine for a long time. So I figured I needed to find something that would allow me to do some mental health, but also give me sort of little breaks in the day with using different parts of my brain. And at that time, I mean, I still do, but I love pediatrics. I love kids. And so that seemed the next most logical step for me to go into pediatrics. And I went through med school thinking, all right, well, I'm going to do pediatrics. Fortunately, I loved pretty much all my rotations. And so I paid attention. I put, because it was an adult rotation, I didn't say, well, I'm not doing adult, I'm doing pediatrics, so I don't need to really learn. Because I'm fascinated by medicine, I learned in every rotation. And then last minute, when you're clicking on what residency you want to apply for, last minute, I was like, I don't want to stop seeing my patients when they turn 18. And I really would like to see the whole family. And so at the very last minute, I picked family medicine, and it was absolutely the best decision.
That is so beautiful that you made your way into family medicine, even though it was like a last minute decision, but that's really beautiful. So you mentioned how moving through your rotations, you realized that you loved caring for patients of all ages. And how did that shape your decision to pursue family medicine?
So I love pediatrics, and fortunately, I still do see a good amount of kids, but being in medicine is a lifelong process. And so it's really, I love being with the patients through a lifelong process also in different phases of life. And so I thought, like if my patient is 18 and is going through some health condition, I don't want to say at 18, well, now you're 18, now you have to go see a different doctor. And then when the mom comes in and saying, well, we're all sick. Can you see us too? I didn't want to individualize breakup families. I really, really loved the idea of being able to take care of the whole family as a unit, because it's so much easier when you know the full picture and the full story. And also sort of just reminiscent of that old time family doctor where they knew you, you knew them, and it was just a really good relationship. And that's kind of what I was craving and going after when I chose family medicine.
I love that. So I had a long interest in pediatrics for a very long time, but hearing after what you said and then kind of like putting that viewpoint of how after 18 years you're not able to see that patient anymore that you like knew since they were born. That kind of like shifted my perspective to going into family medicine and then eventually pursuing that into the physician assistant studies. So I just love how you were able to kind of view that perspective and now that you're a family medicine physician. That's like a really full circle of it. So, healthcare today comes with a lot of challenges from administrative burdens to insurance restrictions. What motivates you to keep going even during those difficult moments?
When I started working, I was really fortunate to start working with a group of women or two other women who are absolutely amazing. And they became really good friends of mine. And we were a really strong team. And we were really able to maintain our boundaries, practice the way we wanted to within the confines of the system, but really just kind of keep it personalized. And so while we knew that the changes were happening in healthcare, we were able to sort of stave it off. And as the years went on, more recently in the last 3 or 4 or 5 years, those changes, those restrictions, the administrative burden became impossible to ignore. And as the insurance world was changing, the healthcare system was changing, so is corporate medicine. And now suddenly, we have to see more and more patients in a day, give less and less time to each patient. And it just no longer felt aligned with the kind of doctor I wanted to be. And, you go into the day and, you're here to do what you want to do and you love it. And then after every encounter, you feel like you left something on the table. You didn't do. At the end of the day, you're running through your mind and thinking, did I miss something? Did I miss something? Because I was in such a hurry. And it was so far from why I got into medicine that it just really became an internal struggle with how I could move forward every single day.
That's amazing to hear, and I'm glad that you're able to even reflect and keep on going during those difficult moments. Because especially with medicine, I feel like there's a lot of moments where stuff is difficult, and it's good to just like keep that going instead of letting it burden you going forward. And I know earlier we spoke on about your passion of patient relationships. Um, why do those long-term connections matter to you so much as a physician?
So I already told you guys that the reason I got into medicine was so that I could have long-term, or the reason I got into family medicine is so that I could have those long-term relationships with patients. But now with patients changing their insurance every year because their employers are making them, or because, they can't get in to see me because I'm all booked up because I'm seeing too many patients in a day, whatever the case is, now patients weren't able to have that continuity with me, right? And that went against every reason I got into family medicine. And so it was really important to me that I continue to maintain those relationships because regardless of what was happening in the world, with the insurance world, the healthcare system, the corporate medicine world, when I'm in the exam room with the patient, and it is just me and the patient talking about their health, talking about what's going on in their life, I'm the happiest, right? Even better if I've seen them through multiple seasons of life. That's what lights me up. That's what keeps me going. That's what, allowed me to leave my children at home and go to work. That's what allows me to go into the financial meetings that are super, super stressful, telling me I'm not doing enough. Because I know once the meeting is done, I get to go into an exam room with the patient and help them through something that they've been struggling with. So those long-term relationships with patients are really, really what kept me going through like the absolute hardest days.
I truly love that. So you're deeply passionate about direct care. Can you explain what direct care is to our viewers and why it resonated so strongly with you?
So direct care is essentially direct to consumer care. And so when right now in the regular traditional healthcare system, I call it, right? You decide you're going to see a patient. You're going to see a doctor. You have an insurance plan, whether it's through your employer or the ACA or Medicare, or whatever it is. You go see that doctor. Maybe you have a copay, maybe you have a coinsurance. A lot of times you don't know. And then after the visit, then the doctor goes and puts a code in, bills, your insurance pays, and whatever's left, you owe. It's like this whole process. Direct care is like, nope, none of that. We're going to eliminate all of that. It's going to be direct to consumer. So patients pay me one flat monthly fee, like a membership, like a gym membership. And that covers their office visits, their text messages to me in between appointments, their checkups, their sick visits, their telehealth, their emails. All of that is covered under that one visit, as if like if you go to the gym 50 times, you still pay that one flat monthly fee, right? Now, patients can have insurance. They should still have some. We all need to have some sort of coverage for major medical or the big unexpected expenses. But for my services, we do not use insurance. And therefore, we cut out the middleman. We are not paying for the 5 or 6, administrators between me and my boss. We are not paying for somebody sitting at an insurance company, sitting there waiting to tell you if you can or can't have this procedure, or if you can or can't see your doctor. Also, in direct care, we have usually about 500. In a traditional practice, a family medicine doctor might have 2,500 to 3,000 patients. So by cutting out the middleman, going direct to consumer, we can have smaller panel size, and therefore we can take better one-on-one care of patients. And it has been a real game changer in the healthcare system. It's disrupting the healthcare system. For whatever reason, we were really made to believe that using cash and going outside of insurance is somehow wasteful or maybe even unethical. And we really have to ask ourselves, who told us that and why? Why, if we have a free gym in our neighborhood, but we still pay for a fancy gym, right? We have free radio, but we pay for Spotify and Sirius XM and all these other things, right? We can get free generic drugs, but we want the name brand because we do better. So at what point did we draw the line for healthcare and say, no, we're not going to pay cash for that. That's not good for us. Even though in an insurance world, it's delayed care, right? You can't get in to see your doctor. It's shorter appointment times. It's technically not better care. So direct care aims to fix all of those issues.
I'm really glad that you're doing like that passionate work of providing direct care because some insurance like can be a little funky like at times and sometimes it creates like a problem sometimes and lately in the media there's a lot of information of I don't know. Lately, I saw someone who got denied from like a liver transplant with insurance. I may be wrong, because I am still young, so I don't understand completely. But I'm really glad that you're providing that direct care for people.
So I'll
And
clarify that there are a lot of wrong denials or inaccurate denials by insurances. Like those numbers are very, very high. I wouldn't be surprised if someone got denied by a transplant. That happens every single day. And the denial rate, the inaccurate denial rate by some insurances is much higher than others. And I'm just doing primary care, right? But if you can get in to see your direct primary care doctor sooner before problems become very big, we can also stave off a lot of other health issues. But also your doctor can help you navigate these really difficult situations. Whereas if you have a traditional healthcare doctor, you've got to make an appointment for every little thing, and they don't really have the time, even though they want to, they don't have the time to sit with you and help you navigate these really difficult questions and obstacles that arise in good care.
all right. So after nearly 20 years in insurance-based healthcare system, what made you realize that it was a time for a change?
The realization was, I think, a long coming before it actually came. And the decision was excruciating. What actually, I was very happy in my practice because I told you that I had those other two women I worked with, and then we had hired this amazing staff, and our work family was just amazing. But things were changing in the practice that just kind of made me feel uncomfortable. And at the time, we were calling it burnout. These institutions spend tons, millions and millions of dollars on physician burnout. I would only learn like 6 months after I quit my job that what I was actually feeling was moral injury and not burnout. But at the time, I didn't have the proper language. So I thought it was burnout. So I was doing all the things that should fix burnout. I was taking vacations, I was doing yoga, I was going to the gym, I was sleeping, I was reading, doing all kinds of things, and I wasn't getting better. Fortunately, about 5 or 6 years ago, I started going to a conference that was in Dallas and then Austin. And it's a conference for women in medicine. And when I started going to it, I just went because, longer story short, but I had read Michelle Obama's book, Becoming, and she talked about really the benefits and the impact of adult female friendships. And at some point in my life, I realized that I had just really not done a good job of maintaining a healthy network around me. And so going to this conference was one of the efforts I put into really just connecting with more people. And when I went to this conference, there are these amazing women on stage who have been on all kinds of newscasts, have all kinds of podcasts, written books, and all this stuff. And I had really no plans of doing any of that, but I just always left inspired and felt connected to women in medicine outside of my immediate circle. So as now I knew it was moral injury was increasing, I sort of had a reference for other women in medicine doing different things. And so contract renewal was coming up, and I went to this conference. And as I was driving back, I had heard someone on stage say, "Don't negotiate out of fear." And I was like, okay, that's my answer. I have 6 months before contract renewal, and I'm going to explore my options so that when contract renewal comes, I don't negotiate out of fear. And that's how I found direct care. I still very, very much wanted to stay. I did not want to leave my work family. I had never been a business owner. I did not see myself as an entrepreneur. I was afraid of being alone. I was afraid of not being able to run a business. Of course, a lot of people told me a cash business can't work. But then just one day, one more thing happened. And I just knew that I just couldn't fix it. And I couldn't make it better for myself, my kids, and for my patients in the system that I was in.
Yeah, that's really meaningful, and I love how you still remember that quote that was said on stage about don't negotiate out of fear, because I think that's something a lot of people tend to do, even us. And the feeling of peer pressure and the pressure to stay in a job where it doesn't satisfy you is a lot of people are doing it. A lot of people are in their jobs that, like I don't know how to explain it. It's just like, peer pressure and a lot of like factors do go into it about you like staying in that job, but I love how you were able to kind of get out of it and kind of pursue your new passions,
Thank you.
of course. So, leaving your corporate job to start your own practice is, of course, a huge leap. What was that decision-making process look like for you?
The way I describe it is excruciating because before I could believe that I could do it, I had to unlearn all the reasons why I couldn't do it. And I really think that before you build a business, you have to build yourself. And, I had been in this system for so many years that told me that I was too much or not enough, that the way I wanted to take care of patients wasn't practical, it wasn't effective, and it wasn't possible. I'm also, South Asian woman, right? We do everything that we're supposed to do, dutiful. We are dutiful. We don't necessarily challenge authority. And these things that kind of keep us in these situations that maybe aren't good for us, but we think that it's good for the people around us, it's good for our family, it's good for our community. And so in order to finally get the guts to say, I'm not going to renew my contract, I had to do a lot of inner work. And I had to really reach out to my network and talk to the women who are already doing it and really say, all right, what do I need to know if I'm going to do this? And so, and there's a huge financial component of it, right? So if you've been employed for X amount of years, then it's nice to have that stated paycheck. And if you're going to go into direct care, you need to plan to not have an income for at least a year or two. And so I knew I was going to have to ask my family to make a lot of sacrifices. It wasn't just about me evolving and me not wanting to do my job, but my family was going to have to sacrifice. And so all these components go into it. So I did not want to leave my work family. And it was by far the most excruciating decision I've made. It really, really shattered my heart because I didn't want to leave, but I knew I had to. And, people say, like, when you said it out loud, did it give you a relief? No, right? Because I knew I was hurting a lot of people along the way. But something in me just told me, you've still got to do it. Just because it's hard doesn't mean it's wrong. And just like one foot in front of the other, and just really keep my eye on what my mission was and what my purpose was.
That is so beautiful. And just you making that huge leap was incredible as well. And congratulations on doing so and still doing it to this day. So, how was practicing direct care changed the way you were able to care? How has practicing direct care changed the way you were able to care for patients compared to the traditional methods?
The most blatant example actually was on day one. So I think on day one, I saw 3 or 4 patients in my office. And like on the third patient, I realized that they'd all been really talking fast, really like at a high speed. And like with the third patient, I was like, you can slow down. We have an hour. And they're like, oh, okay. I'm like, is this how you spoke to me in my other, these are patients that have followed me from my other practice. And I'm like, is this how you spoke to me over there? And they're like, yeah, because you were in a hurry, which is fine. I know you're busy. And I was like, oh my goodness, because I was no longer speaking at that cadence and with that speed. I could hear the difference in the patients. And I realized that to come in and see me, they were speeding up their speech, which is crazy, right? You shouldn't have to do that with your doctor. And so that was like the first moment I was like, okay, this is where I'm supposed to be. And now, I can take care of patients. I take 30 minutes to an hour with them. They can text me between appointments. They can text me and say, hey, doc, what cough syrup did you say I should take? Or like, hey, I saw this on TikTok. Is this true? Or they can come and say, like, I have a lot going on. And I don't have to say, well, we'll talk about 3 things and then you come back for the rest. So it's really taken that time pressure off of patients and really helped me connect to patients on a deeper level.
I truly love that. And I think it's really important to value your time with patients and the way that you were able to kind of like see how fast they were talking, even when you had more time in your appointment. That kind of just like brought out something that is really like made known in like direct care. And so there's even in my situation, there's like whenever I go to my pediatrician, they're like always like, "Hey, what's the issue?" And then I'm like out of the office in like 10 minutes, but for them to see me, it's about 45 minutes. And so valuing that time and kind of like sitting down and talking to them is really important. So I love how you're able to do that in direct care. So, to wrap things up, what advice would you give to students or early career healthcare professionals who feel torn between staying in a traditional system and pursuing a more non-traditional path like direct care?
I think and I teach medical students and I tell them the same thing. The most important thing is to connect with people outside of your institution. When you work in an institution, you feel like the whole world ends outside those 4 walls, right? And those become your friends, that becomes your referral pattern, becomes your colleagues and everything. But it's really important to keep in touch with people sort of all over the country who are doing amazing things in different spaces and in different ways, and not narrow your network into this sort of tunnel vision echo chamber. Because we all change throughout our life, right? And when we change, when we evolve, we need to have sort of these points of references of things that are being done differently. But if all you see is this narrow vision of everybody doing it the exact same, it's going to be very difficult to use your imagination outside that. There's this saying that we can't dream something that we haven't seen. So you can't just make up from thin air, direct care if you have never seen anyone do direct care. So really important to stay in connection with people, network. And I used to think networking was like a bad word, but it's really, really not. It's really just connecting. If you start thinking of networking as connecting, it becomes much easier. Go to conferences. And when you go to those conferences, in between breaks, don't just sit there and scroll on your phone. Meet people, talk to people, keep in touch with those people, connect with people on social media. If you admire what they're doing, let them know you admire what they're doing. And there's a lot of us that when I wanted to start direct care, when I was curious about it, someone had told me that just reach out to direct care doctors in your area and just talk to them. And I was like, they're not going to talk to me. Nobody has an hour of their time to give to me to answer questions. I certainly didn't have an hour of my own time to reach out to them. And I'm kind of like, if you challenge me, then I'm like, okay, well, I'm going to have to see if this is true. So I started reaching out to direct care doctors and they gave me their time. I went to go see one in the city and I sat with her for 2 hours. She answered all my questions. I went up north and talked to a different one. I called one in Chicago and she talked to me for an hour. So these direct care doctors were willing to give me the time. All I had to do was ask and connect.
What I love most is like, obviously, when I reached out to you, um, you giving us a response back was amazing. And being able to just like, I love like on our podcast, bringing so many people on. It's really a great way to connect with people and also show our audience, the people out there, that they could possibly connect with as well. And I love networking. Me and Latika are both in like high school, and we have conferences of our own. We are and host an FBLA, and with FBLA, we're told to connect, network, actually, network, not connect, but network with people around us. And I've loved that ever since. It's a great way to connect with people, and you meet a lot of new people on the way as well. And some opportunities even rise up when you're just networking as well. And never be shy to ask. I've been told that before, and if you don't try, you don't know what could come out of it.
Mm-hmm.
And that's what I've always loved about networking. And I just want to say thank you so much for that advice and for sharing your journey, your values, and the passion behind your work. And your story is incredibly inspiring.
It was truly meaningful to hear how you chose to advocate not only for your patients, but also for yourself and your family by building a practice aligned with your own values.
And to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voices. Your continuing to support truly means the world to us.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes of Battles and Voices.
We'll see you next time.